All right. Thank you, everyone. Welcome back to another podcast, 40 Under 40 Public Health Callus Awards for 2023 for the Boston Congress of Public Health. I'm your host, Dr. Candace Carpenter. I'm the Chief Executive Officer and Chief Strategy Officer of the Boston Congress of Public Health. And I'm happy to have another guest with me today, Christos. I do not want to butcher your last name, so can you say that for me?
Yes, thank you very much for having me. My full name is Christos Tsagkaris. I'm a medical doctor originally from Greece, and I'm currently training in orthopedics in Switzerland.
Excellent. So such a very interesting background being from Greece, training in Switzerland. Tell me a little bit more about your background, Christos, how you happen to, I guess, be a globetrotter.
Certainly. So I was born and raised in Athens, which is the capital of Greece. Then I had the chance to study medicine in the University of Crete. This is an island in the south of Greece. And unlike in the States, we have the system that one can study medicine in Europe as an undergraduate.
Mhm.
And during my education, my very first lecture in the university was about public health and infection control, because it was the time that there was a lot of concern about a potential Ebola outbreak.
Mhm.
And this is when actually my very first day in the university was also my first contact with public health, and my interest grew since that time. As a fourth year medical student, I had the chance to be selected as one of the youth ambassadors of the European Code Against Cancer for Greece. This is essentially a concept of the WHO, its cancer agency, the IARC, and the European Union. It's 12 simple instructions on how to decrease people's cancer risk by up to 50%. So my hands-on experience in public health as a student was promoting and disseminating this kind of information through workshops and also other creative activities. And of course, my education was mostly clinical, and after graduating, I had chance because I have learned in the meantime, apart from English, French, and German, to move in
Mhm.
Switzerland and work originally for a year in clinical research in orthopedics, and eventually to start my residency in orthopedics here. I still maintained interest in public health and got also involved in several civil society organizations. This is a very strong concept in Europe that we have non-profit and non-governmental organizations of young people, or organizations that kind of represent other key demographics, for instance, cancer patients, physicians, and so on. And one thing brought another. And while doing a formal residency, I'm keeping involved in several institutional and non-institutional boards that are broadly related to public, global health, and health promotion, mainly in Europe, but to the extent possible also beyond.
Wow, so you are very busy, Christos. And that's very impressive, like knowing like the French and German, English, and then being from Greece. The thing I'm very curious about, beyond all the boards that you're sitting on, et cetera, is how did you get into orthopedics? And is there a way that you connect orthopedics to some of your work in public health?
Yes, that's a very good question, and the question that I receive quite often.
Mhm.
Because most of my colleagues that share this interest are either directly into a public health residency or are, for instance, working in infectious diseases or oncology, or fields that quite more closer, or seem to be quite more closer to the object of our advocacy. In my case, as a student, I developed a strong interest in the musculoskeletal system. Then a lecturer and now friend that I appreciate a lot, who is a neurosurgeon, advised me that if I want to get really into a system, to delve into the particularities of it, I should also be able to operate on this. And this more or less was the reason why I chose orthopedics. And of course, I also faced the dilemma, okay, how do I combine, for instance, orthopedics and cancer prevention, or tobacco control, or alcohol control, because seemingly they are not related, or not so much related. When we are talking, for instance, about tobacco cessation, we often think about lung cancer, we might think about cardiovascular disease. Nobody gets to think about bones. In reality, they are connected. For instance, it is proven that not only the conventional tobacco products, but also emerging tobacco products like e-cigarettes increase the rates of delaying bone healing, for instance, or create wound healing complications. Of course, we don't need to mention that alcohol and excessive alcohol consumption is a major driver of car accidents, of traffic accidents, and injury that we eventually get to treat. And at the end of the day, it is great to treat, but it is even greater to prevent. And for this reason, I think that, I try to prove it as a testimony that surgeons can have a say and a contribution on prevention of major risk factors that lead to surgical mortality and morbidity at the end of the day.
Yeah, I couldn't agree more. And one of the things that I actually, in the Public Health Summer Institute that the Boston Congress of Public Health put on last summer, we had a course on surgery and public health. And so I tried to make that aware to some of the younger generation that surgery and public health can be, in fact, intertwined, just as you mentioned, right? From the need for a cigarette cessation, alcohol cessation or moderation to prevent issues with wound healing from orthopedic surgeries, or also, as you said, broken bones from having car accidents. So I'm completely in your camp there as well. And I had the same interest and theories about like the intersection of neurosurgery and public health and the number of things that I saw a few years ago in the early days of my residency related to things that were definitely happening on a population-based level with the people who'd come in with certain spinal abscesses or very florid brain cancers or spine cancers. And they were absolutely related to the environments people were in, be if they were like in very rural aspects of the US where we were located, or also like the prisons that they happen to inhabit as well. But I won't go too much into that, but just to say that we definitely have that strong area of resonance. But switching gears a little bit, Christos, you also have a master's in public administration. So you also have this interest in policy development, healthcare delivery. Tell me more about that and some of your accomplishments there.
Yes, absolutely. I did the master in my first year of living in Switzerland. It was actually a remote master, and I had this chance. The university I did it was located in Cyprus, and it offered this kind of study program for people who were already working. The idea behind the master was that in the last 3 years at that point, I was quite involved in European public health affairs, but I didn't have any formal education in this. And I have learned, of course, a lot by experience, a lot by talking to people and working with people. But I wanted also to have some more professional background and to be able to navigate the field better. And although a lot of the things that I came to study during the master was indeed a repetition of what I have experienced in real life, I believe that it has also helped in the sense that it provided me with a structure and an overview of the political landscape, at least in Europe and especially in the public sector. And it's something that I would advise to fellow surgeons or physicians or even public health activists at a broader sense, in the sense that we, of course, learn a lot by experience, and in many cases, experience matters more than theory, but combining them can go places. So it's also something that we need to keep into our mind.
Thank you so much for that. And during, that time, as well as all the way up to present day, what are some of the public health issues that you're most passionate about, and how might, I guess, they differ in Europe versus the US?
Yeah, well, that's a difficult question or a difficult hierarchy to put together. Most of the time, I'm involved in cancer and especially cancer prevention. Through this involvement and also through the people I met and the projects I got involved into, I developed kind of a special interest into tobacco control and also alcohol control. In this sense, tobacco control came through the European Conference of Tobacco Health. There we put together a youth movement that supports the Madrid Declaration for a tobacco-free generation in Europe, and we recently published a paper about this in BMJ Tobacco Control. And then by attending a summer or winter school in Brussels about alcohol policy, I also had the chance to join a group of the WHO Europe related to the contribution of youth in alcohol control in Europe. So I can say that in the broader field of cancer control, I have developed a special interest in this, and indeed there is a reason, also a very strong connection to my everyday life in orthopedics.
Yeah, absolutely. And I know you also, so you said you published some things and you have like a body of research. When you envision your career once you're, all done with residency and you feel things are perfectly combined the way you want them, an orthopedic surgery practice, doing public health, and then global surgery, what does that look like for you?
Well, it's difficult to keep everything together, especially considering that as a high school student, I wanted to become a lawyer and then
Mhm.
probably a judge in my home island, and I apparently didn't manage this. So there are many things that come on our way and we do not expect them. But to the extent that I now understand the field and I can also position myself into this, I would like to remain active clinically because I believe that I receive a lot of input for my activity through the everyday contact with my colleagues and the patients, and also the broader interaction between insurance agencies, for instance, or the broader healthcare challenges and how they are experienced by the average patient, and then trying to bring this into committees, civil society organization, movement, and any other type of positive activity that can function in a feedback loop with the daily clinical practice and, of course, the promotion of evidence-based research in our field.
Absolutely. So big dreams, I find it very interesting too, like the desire to be a judge, but you never know when you might pick that back off the shelf and be able to dust it off along with all these illustrious things that you're doing. Christos, if you had to give someone advice who has an interest in surgery as well as public health, what advice would you give them, given the fact that here in the States, in Europe, as well as in other places, people seem to think that surgery and public health or public health surgeons, that's an oxymoron, or that these things are mutually exclusive. What advice would you give to someone who wants to be able to intertwine these?
Well, I would advise them that this is a totally compatible combination of fields and a field that gives them the opportunity to become unique in the sense that even if you compare, for instance, global health and global surgery, you will see that global health has quite a longer history, and global surgery was even as a concept grounded back in the 1980s because the then director of the WHO gave a speech at the International Agency of Surgeons. And we still have a long way to go. And if you are in the beginning or in the first steps of a broader movement, I believe that you can bring quite more of an impact. And this is the very reason why we need more people involved. And at least in my experience and view, global surgery has done a lot of work into propagating access to surgery everywhere in the world, either by sending people there and creating capacity, or at least by enabling patients to travel. But this is not the end. I believe that the end, and I use the end as a philosophical term from Aristotle, as the purpose, not just the end, is that surgery has a say on all major public health issues because at the end of the day, we also face them in our everyday clinical practice. And we, of course, enjoy operating, but if we manage to tackle some of these issues, we will be able to operate only the people who need surgery. And because at the end of the day, and as global surgery has shown, the resources are limited, we will be able to make the best use of the limited resources that we have in order to serve as many, if not everybody.
I absolutely love that. So yeah, I just wanted to reiterate, like surgery and public health, absolutely compatible, according to you, Christos, and I would agree. And also like you saying just, that we have a long way to go in global surgery. And so with people who are just at the beginning of it, that there's so much more opportunity, to make a big impact, to be able to set the agenda. So thank you so much for that. Um, Switching gears again, how would you say the 40 Under 40 Public Health Award has impacted you so far?
Well, recognition is very important, and it's also very important when it comes from the other side of the Atlantic, where there is a different model of education in medicine and in healthcare sciences. As far as I know, also a different model of practice of public health, and it's also a kind of a bridge. It's great to be part not of a list of a people or a cohort, but of a community of people who might work in different fields, but are united by positive action to improve health as a common good for the population. So it's you know that medicine is more or less handling doubting, handling possibilities and handling uncertainty. So when someone works on a field, we are never sure if we are on the right track. But if we receive some recognition, we can probably be a bit more sure that we are on a good track. And most importantly, we can get in touch with people who can help us improve and correct any mistakes in this track.
Awesome, great. Well, we are so happy to be able to have given you that recognition. And as I said, we, at BCPH, we strive to be an international organization recognizing the great efforts, the impacts that people are making in public health from all over the world. So is there anything else that you'd like to add as we close off the interview, Christos?
Thank you very much again for having me. I would like to repeat the previous advice. Surgery and public health and the broader sphere of public affairs is something compatible, and not only compatible, it's something underserved and therefore essential. I would encourage more and more people to try to get involved in this intersection and build it in a way that can benefit health, communities, and societies at large. And just I wanted also to mention that all that I have said is my experience. Of course, my experience has been shaped by the organizations that I have been part of, but it does not necessarily represent them at the time being. Thank you very much for this talk. And of course, I'm always open to question in the future from people who will likely watch this interview.
Awesome. Excellent. Thank you so much, Christos. So reiterating again, public health and surgery, always a great thing for people to get involved in, an underserved, but nonetheless critical intersection, as you said before. Thank you so much for this interview, Christos. For the audience, if you'd like to connect with Christos, feel free to go to bcph.org and be able to learn more about him and connect there, as well as stay tuned to other interviews that we'll have for BCPH 40 Under 40 Public Health Catalyst Awards. All right, and thank you, and we'll see you next time.